Thank you, Alicia. Our next speaker will be Valerie Edwards.
Good afternoon. I just want to say thank you so much for listening. This is such an honor for me to be able to address you and talk to you about the work that I've been involved with really for about the last 15 years, working on the Adverse Childhood Experiences study. Now, where's the little, here it is. And just to set the stage a little bit, in the U.S., and my numbers are from 2006, that about 905, close to 1 million children either were experienced or at risk for child maltreatment, and broken down a little bit by the types of maltreatment that are reported, and that over 1,000 children died in the U.S. from abuse or neglect. But I think this is just sort of the tip of the iceberg when you start talking about children. And so I'm going to be talking to you today about findings from the Adverse Childhood Experiences study, whose population was adults. And none of this would have been possible without the insights and very hard work of the principal investigators, Vince Valerie and Rob Anda, as well as other members of the ACE study team at CDC over the years who are listed here. And I wanted to just talk to you a little bit about how and where the data were collected, because I think this gives you some idea about, how different it was at the time. Dr. Valerie ran a health appraisal clinic for Kaiser Permanente, and this was a place where you could come annually, if you were a Kaiser member, for a complete physical exam. And they had gotten it down to a very standardized form of exam, and with a standardized questionnaire. They did over 50,000 of these a year, and as it turns out, about over 80% of those who were Kaiser members had had at least one physical. So this was a very popular program in Kaiser. And the way that the study ran was that when people called up and said, I want to go and have a physical, they were sent this form that was called the Health Appraisal Questionnaire, and that had all the information about their current health history, past health conditions, health habits. So that was collected before they went to see the doctor. Then they went and they got a complete physical exam. And where we added on a step in the ACE study was that after they had gone for the exam, we sent them a questionnaire to their home that said, if you don't, would you please send us this questionnaire back that included history on early, before you were 19, your abuse history, and some additional health behavior things that had been missing from the original questionnaire that we felt were important. So all of these things happen separately from each other. We already had their health information before we ever asked them about abuse. Over 1995-97, we collected 17,330 questionnaires. We've been following up, and that goes forward from 2008. So we have about 10 years worth of follow-up data for the folks who stayed within the Kaiser system. We were able to collect information on these people's office visits, their medications, their hospitalizations, and we also performed a national death index search a few years ago using our original population. And I also want to say that we got a 68% response rate to the questionnaire that was sent to their home, which was really pretty phenomenal. And I've looked at the questionnaire a number of times and thought that I would have put it in the trash. And I'm extremely grateful to all the people who participated and were willing to share with us their stories. Okay, so who is in the ACE study? Well, this kind of represents the Kaiser population as well as people who go and get full physicals, because, you know, when you're young, you're indestructible, so you don't need to go for a physical. So the average age was a little older. There was 54% women, and this was a very educated group where over 70% had at least some college. It was also, unfortunately, not a very diverse sample. It was overwhelmingly white, and however, the breakdown did represent the county in which the data were collected, but it lacked in terms of diversity. When we sent the questionnaire to their home, there were 3 categories of abuse that we asked about, and these questions were all adapted from other large, well-known surveys. And emotional abuse the criteria was that you said that often or very often, before you were 18, you were sworn at, insulted, or put down, or that you were often afraid of being hurt. Physically abused, if you said that sometimes, often, or very often you were pushed, slapped, or injured. And sexual abuse here was contact sexual abuse that involved either touching, fondling, attempted intercourse, or intercourse. In addition, there were 5 family dysfunction categories that we asked about. Whether you grew up in a family where there was substance abuse or alcohol abuse, whether you grew up in a family where someone was mentally ill or tried to commit suicide, whether you witnessed interparental violence, whether your parents were separated or divorced, or whether a family member was incarcerated when you were growing up. And sometimes when I think about this, I sort of think about this as like the atmosphere in which the types of abuse might have occurred. So this is what we found when we analyzed the data on each of the ACEs, as I'll be referring to them. And it was really a little bit astounding to us at that time. The prevalences ranged from close to 30% who reported physical abuse. Household substance abuse was about 28% of people. Sexual abuse was over 20%. The least commonly reported ACE was growing up with a family member who had been incarcerated. But we really, I don't think, ever expected to see these kinds of prevalences. Furthermore, we just did a simple integer count of the number of categories that each participant reported. And when we did that, we found out that almost 2/3 reported at least one ACE, and 1 in 5 reported 3 or more. So I think I'm sort of echoing all of the speakers here that when I say that, that trauma is really just so ubiquitous in this community. And this slide I put together just to kind of show maybe a little more graphically correlation, or if you have one ACE, your ACE score is going to be dramatically higher than if you don't report an ACE. And so, if you have you don't report emotional abuse, for instance, your ACE score is going to be maybe 1, maybe you report another one, but if you do, it's up to about 4. So we really found this interrelation between ACEs. We found they were common. There were multiple ACEs were common. It was more common for people to report more than one ACE than one, and that they were indeed interrelated. Well, I think I talked earlier about that, we had all this information on their health history and current health conditions, and I'm just going to go over a few of the outcomes that we found that have long-term graded relationships to ACEs. I'll show you a website where you can get all of our publications. But as you can see, it's very broad-ranging, and I think that was one of the real lessons of ACE, was that ACEs were not only related to mental health difficulties, but were related to physical health difficulties as well. So I'm going to show you a series of slides, and they're all going to be pretty much the same here, where you're going to see on the vertical axis the prevalence, or the percent of people who reported that ACE, and then the type of problem or outcome. And in each of these, you will see, and it gets kind of boring after a while, this graded relationship between the number of ACEs that are reported and the prevalence of the problem. So that the more that you report, the more prevalent or more likely it is that you will also report this problem. Smoking, here we have early smoking initiation, people who began to smoke before they were 15, or who were currently smoking. We have about 18% of the population is currently smoking in the U.S., but I really think that we ought to stop and think about who those people are who are still smoking. Alcoholism. These are people who said that they had a problem with alcohol or considered themselves an alcoholic, or who began drinking before they were 14 years old. And here you see that the people, almost a little over 2% of people with no ACEs report that they have a problem with alcohol. And that's an 8-fold increase in that by the time you have people report 4 or more ACEs. So these are really dramatic increases in the prevalence over time. And these are also reflected in relative risk and but here we're looking at drugs, and this was not a population in which we would have expected to find a lot of drug abuse. Ever used drugs went from almost 0 to about a 6-fold increase with 5 or more ACEs. Ever addicted to drugs, again, the same kind of dramatic increase. And ever injecting drugs, the numbers are just about 0 for people with no ACEs. Similarly, lifetime depression, and this was using the CTID form. History of depression. Here we broke it down by sex, and indeed found that higher prevalence of depression by ACE among women than men, but the same pattern. Here's the ACE score and the risk of attempting suicide, and I think that it's just incredibly telling that the suicide attempt risk is just about down at 0 with 1, increases to about 2% with people with 1 ACE, and then goes up to close to 20% among people who report 5 or more ACEs. I think Alicia talked a little bit earlier about the problem of memory, and we had this one question that said, are there large parts of your childhood after 4 that you can't remember? And we really didn't know what to expect of it. Overall, about 18% agree with that statement. Some of us apparently have better memories than others. However, we go from about 9% with 0 ACEs to close to 40% of people who have 5 or more ACEs agreeing with that statement. And I think that speaks a whole lot to the dissociative processes that go on when people are exposed to trauma. This is something we did with the long-term data. We were able to look at the rate of antidepressant and bipolar mood prescription within the Kaiser, within our Kaiser sample who participated in this study. And this is from using longitudinal data between 1997 and 2004. And as you can see, the relative risk here goes from goes up to about 3 times more likely among people with 5 or more ACEs. The bipolar mood drug prescription goes huge. It's just absolutely a huge increase, although you'll also see that the confidence interval is pretty wide. Very quickly, severe obesity. Here we're talking about folks who have a body mass index over 25. Heart disease. Here's some of the chronic diseases that we were talking about that we found the same side of relationships with. Adult APV reporting either offending or being a victim. Here's work problems, having problems on the job, being absent more than 5 days a week, rating your health as poor. And we know that that's a really good indicator of mortality, is if you think your health is poor. And using data from the National Death Index, we found that people with 6 or more ACEs died nearly 20 years younger than those with no ACEs. And that the average years of life lost was 3 times greater in persons with 6 or more ACEs than persons with no ACEs. I think that this speaks again to the cumulative stressor model that we've all been talking about, either obliquely or in terms of how trauma affects our health. And I'm not going to go a lot into the physiology, but I just wanted to talk. I do think with the ACE study that we really have succeeded in getting people to adopt a cumulative stressor model, and we've even got a new word, polyvictimization, which I think really captures what we're talking about with ACEs. And hopefully, I think through the ACE study that we've been able to talk more about this. It's such a stigmatized issue, and people are so unwilling to bring it up. And we've been hoping that through publishing and spreading this work that we're able to talk about it more openly. Currently, we're collecting data through one of the largest public health surveys, and we'll have 16 states by the end of 2006 where we have ACE data on at the population levels. And we also have a global initiative going with WHO to develop a questionnaire that can be used worldwide. And thank you so much for your attention. I've listed the website down at the bottom where you can get all of our about 60 publications so far from the data set, as well as the questionnaires and other information. Thank you.